Hello, I am Dr. Kirin Palmer with Pure Joy Pediatrics. Hello out there. I am coming on live, waiting for a pediatric endocrinologist who's going to join us, and we're actually going to talk about vitamin D today. I have my practices up in the Pacific Northwest in Portland, Oregon. So if you're looking for a general pediatrician who has the time to answer your questions and put you and your children at ease, we are accepting new patients here at Pure Joy Pediatrics. This morning, I am coming on with a colleague of mine who is a pediatric endocrinologist, and we're going to talk about the importance of vitamin D, who's at risk for vitamin D deficiency, and why it's important actually to supplement with vitamin D. So we are waiting for Dr. Mehra, and there she is. Let's see. For Dr. Mehra to join us. She's on the East Coast. Let's see. And I think that's it. Hey, good morning.
Hi, good morning. How are you?
I'm good, or good afternoon for you, huh?
Yes, I know. Can you hear
I
me okay?
can hear you great. Can
Okay.
you hear me?
Yes, I can.
Perfect. Well, thanks so much for joining us. I came on a little like a minute ago just to introduce the topic for today. I'm up in the Pacific Northwest, and we have a lot of people up here who need to be taking vitamin D, especially kids and teens, and just thought it'd be a good topic to talk about because our days have gotten darker up here, and wanted to talk a little bit more about vitamin D, why it's important, who's at risk for vitamin D deficiency, actually from a pediatric endocrinology perspective in particular, because I think some of your patients are at particular risk. But I'm going to give you a minute to introduce yourself, Dr. Mehra.
Yeah, thank you so much. So I'm Dr. Rinku Mehra. I'm a pediatric endocrinologist. I'm actually in the Washington, D.C. metro area. And we have a similar issue as you guys do right now. It's getting colder, it's getting darker, and we're spending a lot of time inside, and so we are at risk for vitamin D deficiency. I treat kids and young adults with all kinds of endocrine conditions, vitamin D being one of them. And I'm happy to talk to you today about some of these issues because it's so common, and all of us are vitamin D deficient, I would say, at some point in our lives. And it's really important to understand why that is and why we talk about supplementation. And I know you talk about it with your babies also, or the parents of babies, as far as, why it's important. But yeah, I'm happy to be here and happy to talk more.
Awesome. Well, in general pediatrics, I talk to all of my parents about vitamin D supplementation. I think part of it is because I know what area of the country we're in, and like literally we could have 9 months of gray, dark, circumstances, and the kids are inside when it's cold. Actually, everybody's inside when it's cold, and so I usually am talking to parents about this pretty much all day, every day. And I know that there's like a certain recommended daily allowance, and I think sometimes. Oh, we have another pediatrician joining us, Dr. Bhattacharya. Hello out there. I think you might even have kids in Florida that are vitamin D deficient, but I think our kids up here in particular are at risk. In fact, I kind of joke around with parents when they move here and I see them for their first visits and for their first visit, and they've moved here from California or, a surrounding state. And I'm like, we literally should have a sign at the border that says, welcome to Oregon, start taking vitamin D now, both for kids as well as adults. And I would say in my practice, I generally am not checking vitamin D levels because I found that a lot of the insurance companies actually don't cover vitamin D levels. And so it's not something I do regularly, but I do regularly recommend it. So why do we care about vitamin D? Like, what's the big idea about vitamin D?
Yeah, so I think the first thing that we need to understand is what is vitamin D, right? So vitamin D, we always talk about it as a supplement, or, we also talk about it as a hormone, and we talk about it as, really important for our bodies. But what is it really? And it's really one of the 13 vitamins that was discovered in the earliest 20th century by doctors who were studying nutrition. And scientists have defined this as a vitamin. So vitamins are really important for our crucial health and our metabolism. And vitamin D is what's called a fat-soluble vitamin. So it's not technically a vitamin, but it's really important for our health and metabolism, okay? And so our bodies really are designed to make vitamin D. So what happens is the skin on, your body, and really the best place is skin on your face and your hands, absorb UVB light, and then they allow your body to make vitamin D. So you use the cholesterol in your body that comes from your food to make vitamin D, okay? And so the first step is that it goes into the liver and gets metabolized, and it goes to the kidneys, and it's active after it goes to the kidneys. And really what our bodies rely on vitamin D for is to prevent us from having fractures, so to prevent, children from getting what's called brittle bones or rickets in the olden days, where, the bones were, kids were bow-legged, and I've even seen that now in babies and infants who are not who are breastfed and then who are not given vitamin D supplementation. As they start to walk and develop, their bones are weaker, and so they do develop bowing of their legs and weakening. And so we treat that in pediatric endocrinology with vitamin D, actually with the active form of vitamin D. And so vitamin D really is known to keep our bones healthy. So it allows our body, our intestines, to absorb calcium. And with vitamin D, just to give you an example, the body can absorb 30 to 40% or calcium, and without it, only 10%, 10 to 15%. So it can cause, weak bones, thin bones, spinal fractures, and it's really important for our bone health. And then the other issue is that a lot of research has gone on to show what else is vitamin D important for. And vitamin D has actually been found to help with our heart function, our blood vessels, our endocrine glands. It's also been found to be important in, people who have low energy. And so a lot of people say they have low energy, and if you check their vitamin D levels, they can be low.
Right. Wow. That's amazing. So that would explain why, there are certain foods out there. Like I'm thinking of cow's milk. I actually had a conversation with Dr. Adkins, who is a plant-based food wellness and lifestyle coach. And we talked about different sources of calcium in the diet if you're plant-based. But the first thing that comes to mind, of course, is whole milk, which is a very accessible way of getting calcium, and it's usually fortified with vitamin D. Usually what I tell my parents and patients is that you don't necessarily have to drink whole milk, but you do need to have other sources of calcium. But it's kind of nice with the vitamin D fortified cow's milk that you have both those substrates for building strong bones. I kind of think that, as we were talking, I was thinking a lot of families that I work with aren't supplementing with vitamin D because it's not something that you get an immediate effect from, right? Like if you don't take your vitamin D, nothing terrible happens in the short term. But it sounds like, especially with babies and young children, you can have long-term complications from low vitamin D. So our bodies absorb more calcium when we have vitamin D present. The vitamin D is usually activated in our kidneys, but also activated through our skin. And so that would put all of my patients who are here in Portland, Oregon at risk because, 9 months out of the year, everything is covered to here. And then you might even be wearing sunscreen, but it's cold, so you're not even really outside very much. Right. So definitely all my patients are at risk. How much vitamin D do we need to help prevent this rickets and the brittle bones from happening?
Yeah, so traditionally we have said, for babies, 400 IUs of vitamin D, and that's been, what's in the D drops. And now, anywhere from 400 to 800 international units, I think, is okay for babies to take. And as children get older, they have a higher requirement. Usually our teens and adolescents require 1,000, IUs of vitamin D. If they have darker skin, because like I said, your skin absorbs the UVB light. So if you have darker skin, you need a little bit higher dose because you're not going to absorb it as well. Okay. The other thing that makes an impact on vitamin D, and you mentioned being in Oregon, but I will tell you people in Florida are also vitamin D deficient because they are wearing sunscreen or it's really hot and they're inside. And that also affects how vitamin D is made and vitamin D is absorbed. So really across the country, I think we're all at risk of being deficient in vitamin D. And so we do need to have supplementation. And most teens, I will say, do not get enough. They don't get enough calcium, which is important for their bones. They don't drink milk. They don't like it. You know, they have some people have lactose or dairy intolerance, and so they eliminate it. And a lot of people now are going, you know, towards plant-based diets or, you know, almond milk. And so we're just really having a lower level of calcium and lower levels of vitamin D overall. But usually the most, you know, widely used recommendation.
Oh, I can't hear you. Let's see. Oh, there you go. I can hear you.
So usually what I recommend is about 1,000 units of vitamin D for adolescents. And most of the multivitamins may have vitamin D, but it's important to check the multivitamin supplements if they're not getting enough of it to recommend a daily supplement for our teens and adolescents.
Yeah, absolutely. I find the same issue out here too. A lot of my teenagers aren't drinking enough milk or consuming enough calcium containing food, and most of them have forgotten to supplement with vitamin D as well. And so I'll recommend for teens, you know, just kind of a rough and ready source of calcium if they're not milk drinkers is actually just like extra strength Tums. But it would be good for them to also be supplementing with vitamin D. It looks like we had a question out there. Let's see. One important question I get is if sunscreen affects vitamin D production in the skin, so what should kids do? Yeah, I mean, we just, Dr. Mehra just kind of addressed that, but yeah, vitamin D absorption through the skin is affected by using sunscreen. So even children in Florida are at risk, and especially during the summer when it's like really hot and sunny, they just want to stay inside, and the mosquitoes and like just the heat. So everybody's inside, which means they're not getting enough vitamin D either. So they definitely need to be supplemented.
Yeah. And usually what I say is, if you can expose yourself to your face and your hands, if you can expose yourself to the sun 3 times a week for 20 minutes without sunscreen, that's also helpful in making vitamin D also. So 3 times a week. But I know that, you know, we're all like trying to, you know, avoid skin cancer and avoid other damaging issues related to the sun. So there is a balancing act with it. And so everyone's wearing sunscreen. I mean, we're recommended to wear sunscreen, you know, on our face all the time. And but if you have it, you know, if you don't have sunscreen on your hands or even on your feet for 20 minutes, 3 days a week, that usually helps to have your body make vitamin D.
Yeah, absolutely. But, you know, again, like when I have checked vitamin D levels on my patients, it's interesting. Like I find that the kids that seem to have the highest vitamin D levels are my soccer players and my softball players, because they almost are like compelled, you know, to be outside because of practices and soccer games and things like that. So some of my patients will say, well, can't you just get it from your diet? And, you know, when they come in to see me and we're talking about vitamin D, I'm like, well, it's actually a really short list of things that actually naturally contain vitamin D. And I kind of rattle them off. I say, you know, salmon, fatty fishes like tuna and mackerel have a lot of vitamin D and omega-3 fatty acids in the fat that's under the skin. And we eat a lot of salmon up here, but we don't eat it every day, right? Maybe don't eat, and kids maybe don't even eat it in large amounts. And then we've got, if you're a milk drinker, you know, vitamin D fortified milk, whole egg, and mushrooms are the only thing in the plant world. So it's a very short list of things that contain vitamin D, and most kids I know are not eating a ton of mushrooms. So
so yeah, I know. Yeah, right. And so yeah, so like you mentioned that, yeah, fish, shellfish, whole egg yolks, but we don't get enough from, you know, eggs. Fortified orange juice, although I often, as an endocrinologist, don't recommend juice. So We're limited. And then there's, yogurt also. Some cereals, interestingly, do have some vitamin D, and they're fortified with vitamin D also. So you could check the label. Really, it's very limited as far as what we can get in our diet, other than some of the things that you mentioned. So I agree. And usually I'm recommending supplementation for just about everybody. And
Across the board.
Yeah, and calcium supplementation I recommend for everybody the same way that you said Tums. I mean, I'm glad you said that because that's what I recommend too. It's cheap, it's effective. The important thing to know for Tums is that for adolescents especially, it's about 1,000 to 1,200 milligrams of calcium that we recommend in a day. And you don't want to take that all at once because more than 500 milligrams doesn't really get absorbed that well. So you want to take it at 2 different times of the day. So 500 in the morning, 500 in the evening to help how it's absorbed.
That's a really good tip. So one of the things I wanted to get to is like in your patient population in the endocrinology world, like who are the children that you are actively treating for vitamin D deficiency, and like how do you do it? I'm kind of interested to know like how high of a level of vitamin D you're using to supplement with these children, and who in your patient population is most at risk.
Yeah, so I mean, there's a wide variety of ranges of what pediatric endocrinologists will be comfortable with for vitamin D. I mean, I think the reference range is up to 30 and above is considered normal for vitamin D, depending on the lab. Usually I like it to be, in the high 40s to 50 range for kids, especially those who are deficient in vitamin D or higher risk. I will also tell you that patients who have increased weight have a higher risk of being vitamin D deficient because, like I said, vitamin D is fat soluble, so it's stored in the fatty tissue. And for those individuals who have a little bit more fat mass, that fat tissue can hold on to that vitamin D and decrease its availability for circulation. So sometimes it's inaccurate how we measure it. So I do like those levels to be a little bit higher if these kids are on the heavier side or have elevated BMI as well, because we don't have an adequate picture. But usually I recommend, vitamin D supplementation. If they're really deficient in vitamin D, meaning levels, below 10, then I've seen that a lot.
Yeah.
Then I do once a week supplementation, and I do it for 3 months. So 50,000 units once a week for 3 months. And then I repeat it. And, it really takes about 3 months for the levels to increase. So we want to wait about 3 months for those levels, for us to recheck them. The hard thing, if I have issues also with kids taking the medication, because, like our teens and young adults, I mean, I have teens myself, they don't remember to take it. They don't remember to take it every day. And so, sometimes I'll just say, like, let's do, 50,000 IUs, once a week for a little bit less time. Sort of just depends. But if they can take a daily multivitamin, anywhere from 800 to 1,000, I think that's reasonable for prevention of deficiency. But once they get to the deficient range, then I go anywhere from 2,000 to 4,000 IUs. And I use the guidelines from, the guidelines on Up to Date. There's guidelines on Pediatric Endocrine Society as far as what the doses are that you want to use for, depending on what the level is of vitamin D. But the important thing is to take it and to find a way to take it. So sometimes I've had kids come into my office and I give them the vitamin D tablet in the office once a week. And then I know that they're taking it because it's really hard, right? To remember to take it.
Yeah, it's like observed therapy, like for TB. No, you brought up a really good point though. And I talk to my parents and patients, especially teens, I don't know why, but teens seem to be particularly low in vitamin D. And I think part of it is I'm usually checking vitamin D levels as part of a workup for teens that are feeling really tired or fatigued. And 100% of the time, they're usually deficient here. And so I will talk about taking it once a week, because for some families, it may be easier on a Sunday afternoon as you're kind of gearing up and getting ready for the week to just say today is vitamin D day, as opposed to having to remember to do it every single day. You just take your daily amount and you multiply by 7. So if you're a teen and you're not known to be vitamin D deficient, then you would maybe take 7,000, or you could even take 10,000 IUs of vitamin D on a Sunday, and then that should carry you through the week. I also have parents of newborns, those breastfed newborns, there isn't vitamin D in mother's milk. And so children or infants who were exclusively breastfed should be getting vitamin D supplements. And like when you have a newborn, it's kind of crazy and you're not sleeping and your days turns into nights and nights turns into days. And so I'll tell parents it's okay if if you remember that you skipped a day, you can just double the dose the following day.
Right.
Or remember to put it in a baby bottle. So those are some of my tips for the patients that I see around here. And I know that we haven't really talked about adults, but adults, both of us are pediatricians, but adults should be taking vitamin D supplements as well.
Right.
Do you find in your part of the country that when you do check vitamin D levels that insurance companies are reimbursing for it, or do you find that you have to fight for it?
So by the time they come to see me, right, so in pediatric endocrinology, they have been deficient for a long time. And so to be honest, I think I haven't really had a problem with the insurance coverage because they're deficient already. So if I put in that they're deficient, I don't have an issue with it. But if it's routine screening, then it's not generally covered.
Gotcha. Okay. Well, that's good to know, because I think on my side of things is general pediatrics, because we're not actually, what I started doing was just saying the diagnosis was vitamin D deficiency, because I have so many kids up here who are vitamin D deficient that I was like, I'm sure they're going to be deficient. We're just going to call it. And so that's kind of how I've been able to get around it. Well, we have a couple of people out there. If you have questions, just go ahead and post them in the comments. We're talking to Dr. Rinku Mehra, who is a pediatric endocrinologist and sees children and teens who are at risk or who actually are vitamin D deficient, and actually actively helps them get back on track and get back to normal vitamin D levels, if there's any questions out there. But it's been a really good discussion. I think it's really important information, something that isn't discussed enough. And I think when parents know why they need a supplement, it helps. We have a question out here from ABC Doula. Hi out there. How soon to supplement a breastfeeding infant with vitamin D? I'd love to hear your answer, Dr. Mehra.
Yeah, I mean, I would say as soon as possible, to be honest, as soon as you can, because breast milk does not have enough vitamin D in it. And these babies are at risk to have vitamin D deficiency and rickets. And so we're really helping them build their bones really early on. So as soon as you can. Sometimes I get questions about, babies who are a little bit fussier, or, they are, for example, like they're breastfeeding moms. And so, often in those babies, we just recommend just straight vitamin D supplementation. I mean, I think you mentioned putting it in the bottle.
Yeah.
But I don't know if you have other recommendations for ones that are, strictly breastfeeding, who are not taking a bottle.
Yeah. So one of my favorite products, and I probably shouldn't promote any one specific product, but it is a vitamin D supplement meant for infants, and it comes in just one little drop. And so moms can actually just put a drop on their native nipple and breastfeed the baby, and then it's in. I have some patients that are drinking breast milk in bottles, and I'll usually recommend that they do at least one bottle feed after baby's 3 weeks of age. If the mother is breastfeeding and breastfeeding is really well established, I'll recommend that they do at least one bottle if the mother is planning on going to work or transferring the care to somebody else, because those breastfeeding babies, many times once they've really got it down, if you forget to give them a bottle, they will go on a hunger strike until you come home, and that is really hard for working moms. So that's why I can put it in the bottle. I usually have supplements in the office of a standard vitamin D, but I really do like those little vitamin D drops. I think they're super handy. And like I said, if I have, I think sometimes when you're the parent of a newborn, it's a little bit overwhelming. There's a lot going on. And so if they've forgotten, we just kind of gently remind, okay, it's okay. You can start now. It's never too Yeah. And I think there might be a question out there that nobody's asking, but I'll go ahead and ask it, which is, can you have too much vitamin D? And, because I think some parents might be worried that, well, you get some of it in your diet, and then if I give you a supplement and then you're playing soccer, should I just lay off of one of those things, not give you the supplement because you're a soccer player and you're probably getting some of it because you eat salmon often? Is there ever a case for too much?
Yeah, so I will say that if you're out in the sun all day long and you have no sunscreen on, and you are eating, fatty fish all the time, and the other one we didn't mention, cod liver oil, all these vitamin D fortified foods, egg yolks. I mean, that's part of your routine diet. And again, we're talking about teens. if that's the case, or you're out on a farm and you're working, you know, because that does happen in several states, and you're out on the farm and you're working all day long, then you probably don't need that vitamin D supplementation. But it does, you're not going to have too much vitamin D by taking a multivitamin. So if you have a multivitamin with, you know, 600 IUs of vitamin D in it, or even up to 800 to 1,000, you're not going to have too much vitamin D. You know, and we're inside a lot. We're inside, you know, most of the year. Most of us are wearing sunscreen. So it's very rare. In the last 20 years, I have never seen a patient come to me for elevated vitamin D levels. Unless they have some kind of hormone issue, but then you would know about it. So really, you know, the other thing I'll mention is there are a lot of supplements that sometimes people are taking that have vitamin D or hidden vitamin D, or they are taking cod liver oil and things like that. And so I think it's important in those instances to know that those things do have vitamin D in it, and you can have, you know, excess amounts. And in those cases, sometimes we see high levels of calcium in these children. So they have other manifestations, they're nauseous, they vomit, they have lots of other issues related to hypercalcemia, high levels of calcium, which is related to, you know, what's called hypervitaminosis. But we haven't really, I don't really see that often.
Yeah, I haven't seen it in my practice either. And so I just kind of wondered, because I think, you know, I think parents would be concerned, you know, am I giving too much? But I agree with you. I haven't seen anybody with really, really high levels of vitamin D. All of my patients generally are low. And even my soccer and softball players, they're still kind of low on that spectrum. They're probably, you know, they're probably just barely getting enough.
Right.
So, well, thank you so much, Dr. Mehra, for the discussion today on vitamin D. So the take-home points are, everybody, if you're a breastfed infant, on up, need vitamin D. And so if you—
and even adults, I mean, we're not adult doctors, but even adults need vitamin D. I think, you know, I both need vitamin D also. Like, it's really important.
Absolutely. Yeah, no, I've had a couple of teen patients where, you know, we were following their vitamin D levels, and they're not adults, and they were like taking 50,000 IUs a week, right? Once a week. So everybody, like I said, it should be on our, maybe every state should have the sign.
Right.
Welcome.
Right.
Welcome to Florida. Take your vitamin D.
Right.
Yeah. Anyway, thank you so much, Dr. Mehra. Where can people find you out there if they are concerned that their child's not getting enough vitamin D, or have other concerns about their children's endocrine system?
Yeah. So, you know, interestingly, I am licensed in Florida, and so I see a lot of Florida patients, but I'm located physically in Virginia. So Virginia, Maryland, Iowa, and Florida are the current states that I'm practicing in. And they can find me on Instagram, Dr. R. Mehra, or on my website, which is www.themehraclinic.com. And I do virtual and in-person visits as well, so they can certainly find me there.
Awesome. Well, thank you so much, Dr. Mehra. I'm Dr. Kirin Palmer. I have a bricks and mortar pediatric practice here in Portland, Oregon. So if you're looking for a physician, a pediatrician, we are actively taking new patients and would love to meet you. Thank you so much, Dr. Mehra.
Yeah.
Bye.
Thank you.